In this video, I will be talking about the action of shoulder flexion, the muscles involved, range of motion, stretching, mobilization of the joint, and a resistance exercise will be performed. Let's get started. In this picture, if we want to look at the muscles that specifically flex the shoulder, those would include the pec major, the deltoid, the coracobrachialis, and the long head of the biceps. This clip is going to be demonstrating passive range of motion of the shoulder joint. The patient is in supine and completely relaxed, and then I will begin the motion by stabilizing the elbow and wrist, bringing the shoulder into flexion, and bending through my knees to ensure a proper range of motion. The physical therapist should be positioned on the same side of the extremity receiving passive range of motion. By keeping the arm close to your body, it allows for greater stabilization. Slow and controlled movements are necessary. 3 sets of 8 to 10 reps should be performed 2 to 3 times per day. In this clip, I had performed 8 reps. In this clip, I am performing a glenohumeral posterior glide in order to increase flexion at the shoulder joint. The patient is in supine and completely relaxed, and I begin the mobilization by having the shoulder in the resting position of 55 degrees abduction and 30 degrees of horizontal adduction. The physical therapist should be positioned on the same side of the arm receiving mobilization. Making sure the force is applied in a posterior direction, I begin by applying a Maitland oscillation technique at a grade 3 to open up tissue and increase the motion at the joint. I then perform a sustained Kaltenborn grade 2 technique to take up the slack and provide pain relief. Always assess and alter techniques based on the patient's response during the mobilization. In this clip, I will be performing a teres major stretch in order to gain more shoulder flexion by stretching this shoulder extensor. Again, the patient will be in supine and should be completely relaxed. The physical therapist should be on the same side of the patient's extremity you are working on and stabilize the scapula before beginning the stretch. With the scapula stabilized, stretch through the range of motion while stabilizing the elbow and forearm with the other arm. The patient should be instructed to perform this stretch 3 to 5 times per week with 3 to 5 reps, holding the stretch for 30 to 60 seconds while maintaining a low load. This clip demonstrates another way to gain more shoulder flexion by stretching another potential range-limiting antagonist, the latissimus dorsi. The same rules apply for the patient being in supine and fully relaxed. The physical therapist is positioned on the same side of the arm receiving the stretch. Follow the same frequency, intensity, and time principles that were used in the prior stretch. To transition this stretch into an at-home program, a patient may use a cane to assist with the stretch. This picture shows how the cane may be used to assist with stretching. The patient should perform this active assisted technique in the newly gained range of motion. Again, the same stretching principles should be followed. For this resistance exercise, I will first demonstrate it to the patient so he can see how to perform it in order to properly strengthen the shoulder flexors. While standing up with the feet shoulder width apart, the patient will use appropriate free weights to perform slow and controlled shoulder flexion. The physical therapist should be observing the patient for any compensation and provide feedback if necessary. 3 sets of 8 to 12 reps, 2 to 3 times per week with 2 to 3 minute rest intervals between sets. For adequate recovery, 48 to 72 hours between the next resistance training session is necessary. Intensity of the exercise may be increased by increasing the weight of the free weight. Always increase repetitions before the intensity is increased. In a home exercise program, resistance bands can be used to do the same exercise. The patient can stand on the band and then raise the top band into flexion. Follow the same principles for frequency, intensity, and time.